Good morning, students. Today's class is brain tumor. Now, the classification of CNS tumors. It may be primary or it may be secondary. If it arises from meninges, that is called the meningioma. And the glial cell origin, these are glioma, astrocytoma, glioblastoma, all these are glial cell origin. Embryonal, it may be medulloblastoma, neuroblastoma, teratoma, etc. In blood vessel origin, it may be angioma, angiosarcoma, epithelial tumor, other pituitary tumors, pineal gland tumors may be present. Among the secondary tumors, this is the metastatic tumor common from melanoma, breast cancer, lung carcinoma and GI malignancies. As a whole, this is the WHO classification of central nervous tumor. This is not necessary to recollect all these things, but you have to know all just the name. There is a astrocytic tumor, ependymal tumor, glial tumors, other glial tumors, choroid plexus tumors, neuronal and mixed neuronal glial tumors, tumors of the pineal region, embryonal tumors, and the tumors of the cranial and the paraspinal nerves. So, as a whole, this is the central nervous system tumors. Now, what are the characteristics of the CNS tumors? It consists of intracranial, that is brain, and intraspinal tumors. Primary tumors are more common than the metastatic tumors. CNS tumors accounts for 20% among the childhood tumor. Clinical course and the treatment protocol is influenced by grading of tumor. So, grading of the CNS tumor is very important, as the prognosis and the treatment protocol is based on the grading of the tumor. A benign tumor may also infiltrate the large area of brain, lead to serious clinical deficit. Though any tumor involving the critical areas may lead to lethal course. The critical areas like brain stem, a small tumor, even a small tumor arising in the brain stem may cause a lethal course. Highly malignant tumor rarely metastasize outside the CNS because the protecting cover of meninges and the subarachnoid space provide the pathway for spread of the tumor. The loose space, that is the subarachnoid space, and through the CSF the tumor metastasize in the different areas. Now, the classification of tumors. First is the meningioma. There are different histological types along with their grade. I will discuss it later. Then astrocytic tumor. Histologic type are the pilocytic astrocytoma, that is grade 1, diffuse astrocytoma, that is grade 2, anaplastic astrocytoma, this is grade 3, glioblastoma multiforme grade 4, gliosarcoma also grade 4. Now, different oligodendroglial tumors, these are the grade 2 and grade 3. Now, you see, what are the significance of different grading? Like WHO grading, grade 1, these are slow growing tumor. These are mainly non-malignant with long-term survival rate. As it is slow growing and non-malignant, it will be long-term survival. Grade 2, it is relatively slow growing but recurrent and progress to higher grade. Though it is grade 2, but it may progress to higher grade. Now, grade 3, this is significant because these are the malignant and recur as higher grade, and if it is recur, then it will be higher grade. Grade 4, very aggressive and malignant neoplasm. So there are the significance of grading. I will later discuss how will we grade. Here also we are discussing about the different grade, that is low grade and high grade. Among the low grade there are WHO grade 1 and WHO grade 2, and in high grade WHO grade 3 and WHO grade 4. As we told previously, grade 1 is low proliferative potential, frequently discrete nature, possibility of cure after surgical resection alone. So, after surgical resection, grade 1 tumors may be cured. In case of grade 2, generally infiltrating, so complete resection is not possible. If it is infiltrating, the complete resection of the tumor is not possible, and low in mitotic activity, but proliferative rate is low. Frequently recur, some types tend to progress to higher grade, though these are not itself higher grade, but it may progress to higher grade tumors. Now what are the high grade? High grade are the grade 3 and grade 4. Histologic evidence of malignancy, mitotic activity, clearly express infiltrative capabilities and anaplasia is there. Now WHO grade 4, mitotically active, necrosis prone, associated with rapid preoperative and postoperative evolution of the disease. So in high grade there are grade 3 and grade 4, these are the malignant and they have the capability of infiltrate in the local areas as well as in the distant size also. And mitotic activity is high in case of the high grade, and necrosis is also present in the higher grade. But in the lower grade, complete resection, if complete resection is possible, the tumor may be cured. But in case of grade 2, it will recur with a higher grade also. Now you see, diffuse astrocytoma. Histologically, the cells are almost benign, mitotic activity is very low, cellularity is low, not very high, and it is the benign type of the tumor. Now come to meningiomas. These are the benign tumors of adult. These are attached to the dura, arise from the meningothelial cells of the arachnoid matter. Multiple meningiomas, acoustic schwannoma and gliomas are also present. Often these are associated with neurofibromatosis type 2. 50% not associated with neurofibromatosis type 2 will have 22q mutation of the gene. See, these are the pictures of CT scan of meningioma, arises from the dura matter and encroaching to the brain parenchyma, compressing the brain parenchyma. Now the clinical features. These are slow growing tumors. Patient present with vague symptoms due to compression of underlying brain. Common sites are parasagittal aspect of brain convexity, dura over the lateral convexity, wing of sphenoid, olfactory groove, sella turcica, foramen of magnum. These are the common sites of meningioma. It has mild female preponderance. Lesions are usually solitary but may be multiple in association with acoustic tumor. Neurofibromatosis type 2 diagnosis should be considered. It arises from the meningothelial cells of arachnoid. It may be found along any of the external surface as well as with the ventricular system. Now the morphology: rounded mass with well-defined dural base that compress underlying brain but easily separated from it as it is capsulated. Extension in the underlying bone may be present. Surface is encapsulated with thin fibrous tissue. As this is encapsulated, it can be easily separated from the brain parenchyma. Now the different microscopic varieties. There are many classification of histologically. There are many types of the meningiomas are there, but you have to know only this only. Syncytial is the whole structure of cells that sit in tight group without visible cell membrane. Syncytial means there will be no distinct cell membrane in between the cells, or there will be a whole pattern also. Now fibroblastic pattern with elongated cells and abundant collagen deposition between them. Transitional variety which share the feature of syncytial and fibroblastic type. Psammomatous with psammoma body. You know the psammoma body, the holding pattern of the dead cells and calcified material. I will show you the picture later. The psammoma body, presence of psammoma body, that is the psammomatous type, and apparently formed from the calcification of syncytial cells of meningothelial cells. Secretory, PAS positive, intracytoplasmic droplets, microcystic with loose and spongy appearance. You see the different pictures of different meningiomas. Among the grade 1, meningothelial, fibrous, transitional, psammomatous, secretory, angiomatous, microcystic, lymphocyte rich metaplastics are there. Among the grade 2, atypical, clear cell, choroid type, these are the grade 2. And in grade 3, anaplastic, papillary and rhabdoid type of histology are present in meningioma. You see, first one is the meningothelial, or it may be called the syncytial, and holding patterns are there. And psammomatous, there will be presence of psammoma bodies. In case of secretory, PAS positive secretion within the cells or within the small cysts. These are the features of different histologic type of meningioma. Now these are the different grades of different histology of meningioma. Now what are the significance of different grade? These are the grade 1 that have low mitotic rate, less than 4 per 10 high power field, absence of brain invasion, and there are 9 subtypes in grade 1. Grade 2, these are atypical, mitotic rate 4 to 19 per 10 high power field, or it may show the brain invasion, or 3 or 5 specific histologic spontaneous necrosis will be there, prominent nucleoli, high cellularity, and the cells are small. In grade 3, these are anaplastic, mitotic rate is more than 20 per high power field, and specific histologic type are the papillary or the rhabdoid meningioma. So this is all about meningioma and other brain tumors.